Rwanda is located in the sub-Saharan region of Africa and is categorized as a low-income country. As you can see, there is a definite predominance of communicable diseases in the country. In 2004, the top causes of death in order of impact were lower respiratory infections, or LRIs, HIV/AIDS, diarrheal diseases, malaria, and tuberculosis. LRIs, HIV/AIDS, and diarrheal diseases alone make up 42% of the total deaths in Rwanda. While there has been a decline in all of the top causes of death, including TB and malaria, we feel that attention should be focused on LRIs, HIV/AIDS, and diarrheal diseases in general because of their overwhelming impact on death and DALYs, their communicable nature, and the existence of current generalized epidemics in Rwanda. In particular, our rationale for selecting each condition is as follows.
While the HIV epidemic is looking better in Rwanda, there are still several areas that need attention. For example, the rate of condom use among adults is only 28% and the rate of male circumcision is only 12%. There are gender discrepancies in HIV prevalence, which are 3.7% among women and 2.2% among men, and this prevalence has increased among women in recent years. Additionally, attention must be directed to certain at-risk groups who have been excluded in the past action plans. HIV prevalence is alarming 51% among female sex workers, and lastly, there are funding gaps in areas such as health infrastructure and a lack of medical doctors in the country. LRIs are the leading cause of death in Rwanda. There is a lack of data on both long-term prevalence of LRIs and action plans to prevent them. In addition, highly cost-effective efforts to promote breastfeeding, which have been shown to be an effective preventive measure for LRIs, have been largely put aside. And outbreaks of diarrheal diseases most often occur in resource-poor countries, particularly among the most vulnerable populations such as refugees. Because Rwanda is an area with over 50,000 refugees, there is a high risk of infection.
There are a wide range of risk factors for these three conditions, which include poor hygiene, being a refugee, lack of clean water and feces disposal practices, nutritional deficiencies, and overcrowding. Because Rwanda is the most densely populated country in Africa, this represents a challenge for public health officials. The most vulnerable populations for HIV infections in Rwanda are commercial sex workers, prisoners, truck drivers, homosexuals, and women. For LRIs and diarrheal diseases, vulnerable groups include children under 5 and refugees.
We have proposed several immediate interventions and action plans, so these recommendations are as follows. Firstly, increase accessibility to quality healthcare and condoms, notably for sex workers and MSM. This can be done by initiating peer education programs to increase knowledge of HIV and promote condom use. Provide encouragement for voluntary testing and counseling through outreach organizations. Make condoms more available in high-risk areas such as bars, truck stops, and other areas of higher prostitution. Second, improve health system efficiency. This can be done by making use of current available human resources. Some specific tasks could be moved from more highly qualified health workers to health workers with less education, providing effective, time-sensitive training to these individuals. Finally, focus on behavior change strategies. This can be done by developing a school curriculum on sex education that includes HIV. Increase knowledge of the benefits of male circumcision through peer educators.
Furthermore, we must reduce gender discrepancy in HIV. To do so, we can increase awareness of the importance of women being tested for HIV through trained peer educators, radio, marketing, and word of mouth. Moreover, we must ensure that women and girls have equal access to HIV services. Next is the prevention of diarrheal disease. Implementation of methods for safe drinking water and promotion of hand washing with soap can reduce disease risk. Promote food hygiene and knowledge on how infections spread by educating trained peer educators and school teachers.
We need to increase effective drugs and vaccinations. We need to increase vaccination programs such as HIP and pneumococcal vaccinations to prevent pneumonia, and rotavirus vaccination for diarrhea prevention. We also need to increase the supply of water, sugar, and salt solutions and zinc tablets to treat diarrheal disease. In addition, we need to promote the benefits of breastfeeding through peer educators. To detect, monitor, and treat conditions, more medical doctors and other medical staff are needed urgently to carry out any of the interventions put in place. The estimated cost to fill the gap over a 7-year plan is approximately $16 million per year. This constitutes our Rwanda Health Report. We'd like to thank you for your help and support.